Good morning, good afternoon, good evening. My name is Cilia Mejia Lancheros, and I have the pleasure to present our work entitled Strengthening Housing First Services to address the need of people with a history of chronic homelessness after finding housing. I would like to start with the land acknowledgement. I wish to acknowledge that this land on which I am standing today, Toronto, Canada, is the traditional territory of many Aboriginal nations and is now home to many diverse First Nation, Inuit, and Métis people, and also acknowledge that Toronto is covered by the Treaty 13 signing with the Mississaugas of Credit and the William Treaty signed with multiple Mississaugas and Chippewa bands. So the presentation will follow this outline. We will start with a little background, explanation about the Toronto CS-Quali study and the main finding from this study, and finally with the conclusion. So, background. Housing First program has been implemented around the world, especially in high-income countries, including Canada, to help people, including adults and youth, exit homelessness. Housing First allowed people to access to housing and social, community, and health supportive services without any condition of housing readiness. So, a Homelessness study of Toronto site was part of the largest housing fair intervention that was conducted in Canada and started in 2009. A Homelessness study assessed the impact of housing fair intervention on housing, social, and health outcomes. This study of this program provides housing first services with intensive case management or community treatment plus rent supplement to 301 people who was chronic homeless, and then comparing with 2,074 people who was chronic homeless but didn't receive housing first. So the Toronto at Home participant was followed up between 2009 and 2017. During this period, many data related with the housing, social, economic, health condition was collected. So some of the findings from the Homelessness study of Toronto site have been published. We found that a Homelessness study that our participant was able to achieve high housing stability. Also, we found the housing first services has some kind of impact in reducing the number of traumatic brain injury due to physical violence, and also that related with healthcare utilization, we found that our participants with had moderate need for mental health services had increased the number of visits to the primary care, and also that people from the high needs for mental health services decreased the number of visits to the emergency department and the number of days spent hospitalized. Although the previous results are quite positive, in some of the analysis that we had conducted, we haven't seen any positive impact in the severity of substance use symptoms, in the community functional ability, in the quality of life, in reducing incarceration, or reducing mental health related stigma and discrimination. So considering this, we had lots of questions why we are not seeing this positive impact in several life dimensions. Obviously, can be different explanation. Can be that the tools are not catching this kind of feature from different dimensions. Can be that actually there was no any impact or other reason. For helping to understand some of these questions and find some answers, we implemented the Toronto CS-Quali study. The Toronto CS-Quali study starting in April 2020 until October 2020. That was also the period when the COVID pandemic was hitting Canada. So we was able to include 20 participants from Toronto Homelessness study who had received housing first services over almost a year horizon. So we include 10 women and 10 men. And we conducted virtual interviews in which we asking different questions, especially related with housing, stay, residential place, and safety, quality of life, community integration, social participation or inclusion. Also, we asking about social and health services, experience, and life expectation, goal, and needs. So in this presentation, we wanted to communicate some of the funding for these 4 questions. First question is, what 3 things do you wish to have received from this program or agency but you didn't? Question 2 is, if you had a magic wand today and could make your wishes a reality, what role would you like to have in community or society? The question 3 is, what kind of thing will help you to become independent and not use the program services? And finally, what are your life plan goals for the next 3 years? So I just wanted to say that the majority of this question was asking for everybody, but being a qualitative study, when we starting with doing some question, and depending on the result, we span some of these specific topic. So the main finding, we're going to start with the question 1. That is, what 3 things do you wish to have received from this program or agency but you didn't? So I would like to invite you to looking at this quotation that is from our participant and acknowledge what they said. And here I summarize some of the main findings. When we asking this question to our participants, they said that they wanted programs that aim to build housekeeping and cooking activities, program and service to increase their social community functioning. They wanted to have early access to trauma and health services, facilitate and fund the access to dental, oral care services, appropriate health care including pharmacological treatment for complex chronic issues, and more opportunity to change or move to better and safer housing accommodation solution. Also, they said that they would like to have training education to enhance their vocational, self-development, and social communication skill, increase opportunity to access more peer support services or activities, having commuting or mobilization solution of assistance, and access to meaningfully employment solution or volunteering opportunity as peer support workers. So what we can see is, even though all of participants was recognized the housing first have been very helpful and useful for improve their housing and some of the life condition or needs, they wish that they could receive these services. This is our question 2. Here in this question 2, we're asking them, if you had a magic wand today and could make your wishes a reality, what role would you like to have in our community or society? So here again, I invite you to read about some of the quotation that our participants share with us. So from this question, related with the role in the community or society, we can see that these participants, all of them are enthusiastic in having a role. They wanted to be useful for the society. They wanted to help others in that are in their similar condition before they moved to housing or when they was on the street. So it's important to acknowledge this because we should give the opportunity to them to make to play an important role in the society, but also to make them feel that they are inclusive and they have something that can contribute to improve their communities and the society in general. So around the witch's role in the community society, they said that they wanted not being dependable of the system. They wanted to do a social community job. They wanted to be a peer support agents, especially helping people with mental illness, homelessness, substance use disorder. Some of them wanted to be a caregiver or a street social worker. Others wanted to end poverty and illness. Someone said that wanted to be a writer and talking about inequalities and how they can be fixed. Others just wanted to be able to be an integrated person in their community. So when we asking about the things needed to help achieve this role, they say having unemployment, opportunities. Even they don't wanted a very high qualified jobs because they recognize that they don't have many skills or they have lost the skills. Many of them was happy to do manual jobs as a cleaning, helping in a supermarket, even helping as volunteers. The majority of them said that they wanted to have more education and training and improve their communication skill because obviously having spent many time in the streets and in somehow excluded from the society, they had lost this communication skill. Also, they wanted for making this role having more goal and plan and to feel ready that they can be independent and functioning and collaborate in the society. Others say that for helping to achieve the role, they should be integrated in a small group or had one-to-one personalized help. And others say that it requires to be focused and having a strong network and economic capability to influence decision makers. And finally, they say increase the ability to keep thoughts together and be self-confident. This is important as many of them, even though some of them are high educated or have different skills, they don't feel self-confidence. And also some of them had serious mental health problems, so they are scared or or show that they can do or be part of the society. And also they wanted to build self-determination. We can see this is very, very important thing that we need to consider. And the question 3, we're asking what kind of thing will help you to become independent and not use the housing first program services. Again, here we are presenting some of the quotation or participant and I invite you to read them. So this is the summary of the kind of thing that will help you then to become independent and not use housing fair program services or support. Some of them say they wanted to get assistance in seeking outside prospective jobs, job opportunity without health and age precondition or discrimination, volunteering opportunity with a win-win situation. Some of them was not only interested in getting money, but also in having some kind of exchange support by providing volunteer services in exchange of transportation token, grocery, and other services that they need. And they also say that a more inclusive community with positive, strong network opportunity from them will help them to use less housing fair program and other social support program. And something very important in the finding was income sources and higher financial assistance. Some of them spoke about universal basic income. And finally, they say build self-confidence, determination, self-advocacy, and skill. However, we also had group of people that say that even though the program had different kind of activities and some of them was able to participate in that, they wanted to see more diverse program activity that will help them to improve other life conditions outside the housing first and outside the at-home program activities. Also, they wanted to have more affordable education and skill development opportunity. Although this for them there is very important, some of them was studying, they found that access to high level education are quite expensive. So, and their economic condition did not allow them to follow that goals. And other one, more affordable phone and internet solution so that they can be connected, that they can looking for opportunities, job opportunities, social networking, as internet and phone services is quite expensive. So there are say that if there was more affordable communication services, they may have better possibilities. Other wanted specialized and early medical treatment, especially for mental and physical health issues, as they said that sometimes it's so late when they get this kind of treatment, and sometimes they don't have received the appropriate specialized health issue for their physical problems, or they was not well oriented or was very difficult to access to these services. And then they said that they wanted affordable housing solution because they would like to move from different to other housing accommodation outside that the housing fair program provide. Especially they wanted to live in different areas, having a bigger house and be able, for example, to have a family or their family members. And also they spoke about reducing discrimination and stigma, because even though there are they want to be independent, they find many structural and system discrimination and stigma, from access to health, access to employment, to education. So one of the things that I said before, we're asking about the basic income, and we're asking about the amount, and this is one of the some of the sample what they said. Practically, they said that they believe that the basic income should be between 2,000 to 3,000 Canadian dollars per month. So that they not only can cover part of the rent, but also be able to cover some of the prescription, having better nutrition, and allow them to do other social or education opportunities. And our question 4, we asking, what are your life plan goal for the next 3 years? We can see here some of the strat that they say, that they share with us. And here is the summary of the life plan goal. So the majority of them wanted to traveling, more income to be able to save money, studying on improved career skill, being more close to the family member, secure and stable full or part-time employment, go to school and retrain, write a book, marriage, live outside the city. Some of them wanted to live outside the big city, secure a better housing. And for the some of the things that will help them to achieve this goal, some say having a stable employment opportunity, more stable money sources, have affordable education and training, being connected with different employment and network groups, be connected with the social activities available in local residents, including volunteering position, find accommodation at a better price and in better place, maintain government financial support while transition out the housing first and other social programs. Many of them was quite worried that if they get some kind of full employment or they are able to pay the rent, the government are going to cut their financial support. but they are afraid that after a while they become again homeless. So they asking for the government to continue with this support while there are strong socioeconomically to continue without this help. So as we can see, these four questions somehow are interrelated, and many of them point in the same topic. And here are some of the conclusion for this. One is that once the participant reach housing stability to Housing First program, they require further robust support services and resources to help them to exit poverty. Even though they become unstable, they continue to experience poverty. So one of the strategies is that they are successfully be integrated with the workforce, affordable access to education, training program, and work opportunity, effective connection with the work and social network opportunities, and increase the amount of financial support. Even though many of them receive disability financial aid, is not enough for cover their basic needs. Continue with the recommendation also to improve their social and community integration and inclusion. Is important that enhance self-confidence, self-determination, self-advocacy, create meaningful opportunities, safe spaces to connect with clients, with different organizations in their community, initiative to target structural individual stigmatization, promote coaching, facilitate family and friends connection. And related with the health, more specialized, multidisciplinary mental and physical health services, and especially that these kind of services are able to be accessed early in time and they are appropriate to help them to treat their mental and physical issue. And also it's important to consider expanding trauma programs, as the majority of these participants had experienced long-lasting trauma over their life course. Affordable access to oral care, because it's very expensive, as they say, they can afford that. And also early access to housing will be held then to focus in the health issue. And finally, to improve the home place attachment, so more structural, sustainable, and partnering support is required to facilitate access to safe and appropriate housing accommodation to fulfill individual needs. And when moving to homeless people to housing, consider the neighborhood characteristics, the type of accommodation to meet the individual needs and their recovery, and community integration. Provide housekeeping, cooking, and shopping training to enhance the adaptation to and the management of their home needs and space. And this is the conclusion. In overall, is an intersectional, multisectoral, and sustainable support services are required to prevent and end homelessness and enhance the well-being, recovery, and social participation of those affected, and also for strengthening all the Housing First program that are implemented, because we know the Housing First program is not the solution, giving a solution for all multidimensional needs that people with experience of homelessness have. And finally, I would like to thank everybody, including the participants, the community-based agency that provide Housing First services, and our qualitative study team. Thank you very much for your attention, and whatever question you had, feel free or email me that. Thank you.